Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Transient proteinuria. Transient proteinuria are mainly associated with conditions like cardiac failure, fever, heavy exercise. These are important in transient proteinuria. In transient proteinuria, here the proteins, there is proteins. These transient proteinuria are proteins in the urine are positive after the cardiac failure or after the patient suffers from fever or after doing heavy exercise. You will see proteins are positive in the urine. So this is transient proteinuria, and they will disappear within hours of cessation of the exercise. And once the patient stops the exercise, then the proteins will disappear and there is resolution of symptoms again when he starts the exercise again. So this is what is seen. So for example, a person, if he is uh, a marathon runner, then after marathon running you might see a proteinuria of almost 5 grams per liter of urine may be seen if in these patients. So this is transient proteinuria.
thank you and thank you for watching.